Hi, my name is Lyle Murphy, and today we are going to be talking about a medication called Trintellix. And these are some of the questions that our readers and viewers have asked us to answer on their behalf. The first question is, what is Trintellix like, especially as compared to Zoloft? Trintellix is a relatively new drug in comparison to drugs like Prozac, Paxil, Zoloft. It may take a little bit of time to get, the real comparisons in, but as approved by the FDA, the FDA has approved Trintellix for major depressive disorder, whereas Zoloft has approvals for anything from PTSD to panic disorder to OCD and a host of other things. So by labeling, Trintellix is not approved to cover those things, even though it may have some, I hate to call it efficacy in that way. I mean, I think that having a holistic lifestyle is a much better way to have control over these symptoms. If your body is functioning well and you're eating clean food and you've got the poisons out of your system and you're exercising, this is a way to actually build up your mental health rather than poisoning it with medications. But if you are comparing medication to medication, Zoloft has a wider range of things it's prescribed for. Trintellix so far has produced less side effects in people than Zoloft, slightly. And Trintellix has had more cases of nausea. So it really depends. Some people have, side effects on one medication. They don't have the same side effect on other medications. But typically, I would say that, Trintellix it's not going to be the worst of the worst when it comes to antidepressants. It has this longer half-life, so it makes it easier to get off of, has less sexual side effects, and anyway, that's a comparison to Zoloft. Zoloft would have probably more sexual side effects than Trintellix. All right, next question. Does Trintellix target receptors other than serotonin? Trintellix actually, it's a little different also than some of these other antidepressants in that, and this is the next question too, how is Trintellix different from other antidepressants? So I'm actually going to combine these two questions. A medication like Paxil or a medication like Prozac is believed to be dealing exclusively with the reuptake of serotonin. So they block the reuptake of serotonin, which makes more serotonin available for your receptors, however they're functioning. Trintellix actually augments not only the serotonin reuptake, but actually augments the receptors as well. But it is very specific to serotonin. So obviously, it's kind of like a teeter-totter. If you have more of an inhibitory neurochemical, you're going to have less of an excitatory neurochemical. So it would it's not going to change the amount of dopamine you have. It's just going to change that you now have more inhibitory control over that excitatory dopamine, if that makes sense. So I guess the answer that would be the most straightforward is Trintellix is not going to target other receptors besides serotonin specifically. Okay, next question. How do I know if a Trintellix dosage is too high? What symptoms are notable? Well, honestly, even people who overdose on antidepressants, take the whole bottle, may feel little to nothing from that. So it's a little bit of a hard question to answer, but if you're feeling symptoms, especially in the nausea, vomiting, and oversedation, these may be signs that that you're taking too much. They may be signs that you're just adjusting the medication as well. But if you're still feeling those things after 2 weeks, maybe the dosage medication is too high. Next question, is Trintellix a better option than Viibryd? Trintellix and Viibryd are actually, if you had to compare two if you had to control If you had to compare Trintellix to another antidepressant, Viibryd would be probably the closest analog because they both are these atypical antidepressants where not only are they reuptaking the serotonin, but they're actually augmenting the serotonin receptors. They both do that. There's not any really good studies out there that took these two drugs head-to-head as far as comparison. Trintellix was compared to Zoloft, and then Viibryd was compared to another drug. But it would seem as if, with the research I looked up, that Trintellix was better tolerated than Viibryd, and that was probably the most notable thing that I saw. What happens if you stop Trintellix cold turkey? Well, you generally don't want to stop an antidepressant cold turkey unless there's a medical urgency to do so. I mean, why? It's kind of like it's like asking, like, what happens if you step off the roof of your house instead of walking down the stairs? It's like, well, you break a leg, you like smash your head. It's not necessary to do that. You just taper it out slowly, and you don't have to find out the answer to that question. But it could cause some severe sleep problems where you can't sleep. It could cause severe impulse control problems where you're easy to anger, you're easy to cry, you're easy to hurt yourself. I mean, you could lose impulse control for a period of time, and could cause you a lot of anxiety. And it's just, I don't think that cold turkeying medication like Trintellix is worth it. So just don't. In your opinion, next question, in your opinion, is Trintellix easier to come off of than Celexa and Lexapro? Now, Celexa and Lexapro are kind of like middle range as far as challenging to get off of, where like Effexor is like, right at the top. Cymbalta is pretty bad. Celexa and Lexapro are kind of here. I would say Trintellix, even though not, by and large, the majority of people come in on those other drugs. There's not a lot of people that are prescribed Trintellix, but it has a longer half-life, and generally drugs that have a longer half-life are easier to get off of. So I would say that, yes, Trintellix would be easier to get off of than Celexa and Lexapro. I haven't had a tragically complicated Trintellix withdrawal yet. We use some pretty savvy means to be able to do that, so I don't know exactly what the consumers out there would be experiencing without that type of support. I don't have enough of a population base to really like ascertain that. I talk to a lot of people and hear a lot of stories, and it sounds like Trintellix is better tolerated to get off of than the other two. All right. Next question. Trintellix causes anger outbursts, but is that really a serious concern or fake news? So if anger would be a paradoxical reaction to the medication. Generally, a medication that raises your serotonin is going to reduce in anger and impulsive sort of, I gotta kill you sort of things. So it could be a paradoxical effect to the medication. Antidepressants are notorious for having paradoxical reactions where you expect them to help with your depression and they actually make you more suicidal, or you expect them to help you with your impulse control and actually make you more impulsive. So it's not the common effect. I mean, I wouldn't necessarily call it fake news, but where you would see people having problems with anger outbursts would be if they did a cold turkey or came off of Trintellix too suddenly. That's probably more where you would commonly see an anger outburst, or if you forgot your medication or something like that for a day. Okay, next question. I smoke marijuana and know that it interferes with some antidepressants. Is there research to say if marijuana affects Trintellix? If you look, you could probably find research on just about anything, but marijuana has a very diverse set of, it's a very diverse chemical. There's a lot of different cannabinoids in there that affect dopamine, serotonin, endorphin pathways in very different ways in different people with different strains, and but it's not just a straight serotonin medication, like Trintellix is. So I don't see them being, like this. They're not gonna like have some drastic interaction for most people. But I don't know. I mean, I'm not a pot smoker, so I end up dealing with a lot of people who have marijuana-induced psychosis and other things from, not having the physiology to really tolerate marijuana. And, if a person's smoking a lot of marijuana and that's what's making them depressed, and then they're taking an antidepressant because of that depression, maybe there's some things to look at. But otherwise, if you want to smoke pot with your Trintellix, I don't see that being a problem. Okay, next question. My bipolar spouse spends all day in bed. Is this the illness or the Trintellix and Seroquel? Well, Trintellix and Seroquel are probably going to have you, you're going to be in bed a lot because they're both very sedative. And that's what they're trying to do to alleviate the manic phase of bipolar. They're knocking out your ability to perceive reward through the Seroquel and the dopamine, and they're also kind of anesthetizing you by giving you more serotonin. So probably. There's a lot that can be done for bipolar with diet and exercise and, not doing stimulants and coffee and sugar and just, trying to balance it out that way. I would strongly suggest working with a naturopath and get some of that stuff in order and then see if those drugs are still necessary. Next question. What can I do to relieve a severe itching side effect that started after taking Trintellix? Is it possible this side effect will be resolved? I have taken antidepressants for 20 years and I have survived weaning off of Effexor to transition to Trintellix. So congratulations on the transitioning. Transitioning off of Effexor is not necessarily an easy path, and I'm sure it had its complications, and good job on that. Itching, it depends on if the itching started and you're just now starting the Trintellix and it's a new side effect, or if you're a month or 2 months into taking the Trintellix and you still have the itching. Itching can be indicative that you're having a bit of an allergic reaction to something either in the medication, in the binders, or otherwise. And it's not a side effect I would think that you would want to try to combat long term. If you're in the first 2 weeks to a month, it could potentially resolve. If it's lasting longer than that, that could be a concern. And I would talk to your doctor about that because these are the things that they need to know when they're making these medication decisions. And it might be a bigger issue than, or it might not, you don't really know. But to me, itching is not going to be like the best kind of side effect to have. It does denote that there might be some sort of allergic response. Okay, next question. Is it okay to take CBD with Trintellix and mirtazapine? Generally, yes. Again, everyone's different. I've seen people who have gone psychotic from taking CBD, even though typically CBD has an antipsychotic effect. It actually mediates the effect of the THC, so that an animal that eats it or a human that smokes it doesn't go completely psychotic from the THC. It sort of balances those two things out. But and CBD might be a great way to transition off these drugs. Now, taking the Trintellix and the Remeron, the mirtazapine, at the same time might be an effect. You have to ask yourself why you're taking 2 antidepressants. It's like one antidepressant doesn't do it, just take 2. So another case where you might want to go down the holistic path and see if there's another way to work with these symptoms rather than just keep throwing more drugs at it. Last question. Is Trintellix a common backup if Zoloft does not work for anxiety? No, it's not a common backup. It may have an effect on anxiety, but Trintellix is not FDA approved for anxiety. It still could be prescribed for anxiety off-label by the doctor, but it hasn't passed muster on having the FDA approval. So you know, there's a lot of things that can cause anxiety. You know, if it's constant anxiety, it may be that you have a toxic nervous system, and you need to work on unpoisoning that and work with an environmental medicine specialist to do so. If it's intermittent anxiety, there's a whole host of reasons why that could be, either interdosing withdrawal or blood sugar or vitamin D levels or blood sugar issues or hormonal shifts. And again, your psychiatrist is not going to get into those type of things. This is going to be for your family nurse practitioner or for your naturopath. You know, these are the people that are going to run the tests that are going to get you know, deeper into why you're having anxiety. And I would encourage you to pursue that in addition, you know, to what you're already doing. But, you know, just I mean, you may be a fast metabolizer. Usually when antidepressants don't work, it's because the person metabolizes it so fast that the efficacy isn't there. But, you know, work with a holistic doctor. You know, it's time. All right. Well, thank you. I really appreciate the questions. Keep them coming, and we'll keep the videos rolling. Have a good day, and be sure to like, share, subscribe, and we'll see you on the next video. Thank you.